Another episode of Twisted Toast coming your way. I'm getting a lot of really great feedback from people. They love you. I annoy some people. You look gorgeous. What'd you do with your skin?
It's the red lipstick.
It's the red lipstick. Yeah. What is that with women in red lipstick? I remember. What is that? Is that like, it's like a thing, huh?
I guess. I don't know. I just thought it looked great with the black hair. It looks like I have lips instead of not having lips.
So, what do you want to talk about?
I want to talk about your background.
Which one?
I don't know. What is like a simulated background? The other one's your real background?
Yeah, we don't know who the real Twisty is today.
I like
One's
I
my
like
real office, my
I
new
like your
house
real
that
office better.
what's that?
I like your real office better.
It's gonna be there. It's cool. I got a bush quail sign from '92 that I'm gonna have in the background, and I got old telephones, which I'm
Oh,
really
that'll be
excited
cool.
about. Like I love phones. This is
It
all
looks
about
like
communication.
it looks like messy paint on the other one though. I'm trying to figure out what the green thing is behind you over
That
your
one's
right.
simulated.
I know, but what is that supposed to be?
I think it's
I
a
wish I could
plant.
point at it and show you.
Plant?
That
Yeah, it's a
looks
plant.
like a green lobster.
Yeah, it does. What'd you do this weekend?
I was at Life Vision Extravaganza all weekend learning all about new things.
Was it an extravaganza?
It was a good experience. It always is a good experience. I learned a lot of cool things. Del Bigtree opened it up, and of course, it was a powerful conversation. He spoke about a new study that hasn't been published yet, but there's a new movie that he has made that's coming out called An Inconvenient Truth, which is a study that was done on vax versus.
That was a Michael Moore movie, wasn't it? Is he
I don't
stealing it?
know. I didn't know they had a movie called that. I know he had a movie called Sicko, which was awesome.
I think Inconvenient Truth was, let's see. So Dell was there.
Yeah, so like the report was made in 2020 apparently on vaxxed versus unvaxxed and it had like 18,000 participants in it. And Dell had somehow gotten in contact with like one of the lead doc researchers at the Ford Institute, and he agreed to do a study on vax versus unvax, basically probably from Dell's point of view, from what I understand from his talk, thinking that, they were going to prove our side wrong, if you will, that vax kids are more healthy than than vaccinated kids. I don't know if I just said that right, that unvaccinated kids are healthier than vaccinated kids. And so it turns out that they are actually healthier than vaccinated kids, but it has not been published yet. And they mentioned it in the most recent congressional hearing, Senate hearing, so it would be on the record that this has come out. And before they did this study, they had asked the doctor, this lead doctor from the Ford Institute, if either way, right or wrong, you'll publish it. And he said that he would, but he hasn't published it because, of course, he'll lose his job. So Dell made a movie about it, and just this inconvenient truth, and it talks about all the differences between kids that have been vaccinated, kids that have not been vaccinated. We're talking like a 400% increase in diabetes, autoimmune disorders, not 400, but like various degrees of increased thresholds that are significant in different kinds of health problems. And then even like some of the stuff were 0% for the non-vax cohorts. I couldn't tell you exactly what those things are, but I know that that movie is supposed to be coming out, I believe, I want to say October 1st, but sometime in the month of October. So it's going to be totally awesome.
That guy's super cool. Was there any other? Well, I want to ask you this. Do you think, because I always think the answer is sex. If we look at Viagra getting the fastest ever turnaround time in the history of drugs, we should be studying the effects of vaccinations on hard dicks, because that would move the needle.
I think that you should propose that, Tristan. You should put that
I'm
out there.
I'm gonna donate
You
money
need
to
to
that
find somebody
research.
that wants to do a study on that.
Well, I mean, okay. I actually was going to release this week. It's a 5-part test to show how chiropractic impacts sexual health. Pelvic blood flow test, sacral nerve reflex test, HRV, pelvic floor strength. What else do you think it needs?
I mean, I don't know. That's a good question. I'm gonna have to think about that. I've told you my stories about how I have a number of patients after they get they'll come in with low back pain, sacroiliac pain, and they'll come in. I remember the first guy who ever came in, and after his first adjustment ever, he had never told me that he had any problems, which I don't think he thought he had any problems until the next day he comes in and he's like, "Hey doc, can I ask you a question?" He's all looking sideways, making sure that nobody's gonna hear, like it's a super hush hush question. I'm like, "Yeah, what's up?" And he's like, "Is it possible that that adjustment that you did yesterday could have an effect on, you know, on stairs. And I'm like, yeah, well, the nerves that come out of the I was like, yeah, you have a sacroiliac problem. The nerves that come out of that part of your body, start of the reproductive system, the bladder, the lower bowel, all those things. He's like, because I got to tell you, doc, I had the most amazing erection of my life. And I was like,
Absolutely.
good for you, dude.
I've talked about this with one of my old dudes who said, he's doing upper cervical, and the guy comes in, and the patient comes in and goes, I still had the headaches, but last night, doc, I stayed up and railed my wife for 4 hours straight.
My goodness.
So I say this, like, for anything that anyone wants to care about, if you can always tie it back and bridge it back to the dick, it will make way more impact faster.
Only for men. Only for men. Only if the
But
man
that's,
is the controlling entity.
I know it sucks, dude. Kat was asking me the other day, she found, I take Rugolet now, or Rugelette, and it looks like gum. She goes, you can't leave this out for the kids. And I said, well, man, they'll have a great night, I guess. I don't know. But I love it because it also has like 3 components. And I was on a run this last 4 days in Rochester. I mean, a run. So, I mean, I bought a bar. So maybe we can talk about that.
I saw that. I need to know more.
Well, it's going to be a tax haven, and we're gonna convert into a strip club. But my wife will let me. So, I just want to like money launder there.
I don't know if you should like say things like that on something you're
I
gonna
think that's the
publicly
whole thing. I'm
post.
gonna say it because then they'll just go, he's just got to be fucking joking. No one would actually admit. And then the other thing is, how the fuck are they gonna find out? That's the truth.
You're
Like,
verbally admitting it right now?
no, then I was just joking. This is for entertainment purposes.
Hmm.
So,
Okay.
anyways, I was on a run.
Anything you say can and will be used against you in a court of law.
They won't catch me. The I was on a run. I got some party favors, and I was up for 3 days straight. And then I missed my wife, and I was like, oh, I got to use this route. I didn't really need to, but it's amazing stuff. And it's so much funny when you talk to dudes in chiropractic who are like all holistic until you're like, do you use dick pills? They're like, absolutely.
I was having a conversation. I was totally joking with somebody the other day, a male doc, and we were talking about blood clots with the COVID vaccine because we all know that that's been, documented at this point. Ooh, I'm echoing.
Keep going, huh?
And I was like, I mean, what would happen if you got like blood clot in the corpus callosum in one of those arteries there, right? You know what I mean? But would that be like the forever hard on at that point, or would it just cut off blood flow to your penis? Like, what do you think would happen? And he really didn't know what to say.
I got scared one time on it when I was younger. I thought I was gonna have to go to the hospital and have one of those like, oh shit moments. But hey, again, moral of the story is if you push stuff through, you want to push stuff through. Even chiropractic, you got to do it through sex because sex sells.
It does sell. You are absolutely right about that.
So we did a video. I was so fucking I was like in my zone, like my genius zone. I think they call it, right? We're doing comedy ads for my docs, and we go down and we're doing documentary and comedy ads. And we did a parody of the classic scene in Meg Ryan and Billy Crystal when Harry Met Sally, and she does the fake orgasm. And the whole idea behind it was that we're going to do, you can't fake health. You can, and so the scripting was, basically I can fake health. I can mask it. I can, put pills on it. And Dr. John's like, you can fake a smile, but you can't fake health. And she's like, you don't think I can fake it? And she starts doing on the table a fake orgasm. We did it probably like 4 or 5 takes because we're all cracking up, but I think it's going to come out really, really awesome. So I'm really grateful for Dr. John for letting me like do different stuff. And I'm really grateful for my people that let me allow to do like and do cool shit and talk about sex and capture people's attention. So would you do a comedy ad for your practice?
Yeah, because you know what? I've been thinking lately about doing a crack ad.
I'd be like,
crack. Best crack on the street.
Dude, I love it. Like real, like go in the ghetto and film it.
I just think it'd be hilarious because so many docs are like, don't say the word crack. And I'm like, why not? Like, it's a joke. Like, don't get offended so easily. People understand that that's not actually what we're doing if you know how to educate properly. And even if they still say that, I mean, I still have people that come in, oh, I need to get a good crack. And I'm like, okay, I got the best crack on the street.
Yeah.
Like, don't take yourself so seriously. I think it's a good idea to joke around stuff. And, even the malpractice carriers will tell you, how do you not get sued? You make your patients laugh. When they like you, they don't sue you.
Ooh, that's a gold nugget for today. I've been on that nut for, I came out of Dr. John's office and I've been doing these on-sites, and the differences between the practices that not only make more money, but the KPIs that make them make more money, retention, conversions, all that kind of stuff. And I'm like, there's a likability and lovability, like index, if you will, that there's a I was telling John, I was like, it's better than home, because home can be like shitty for a lot of people. It's an escape from them from being at home. That's why they like, and they kept saying the same things. I just love coming here. He puts me back together. And I'm sure you get the same things. Like, it's just, they're simple things. And I feel good. I feel good doing, well, I've been coming here for 5 years, and I would ask, I was doing testimonial videos. I'm like, the cliche or the joke on the street is they say that you got to keep coming back for a chiropractor. And, there's chiropractors say you don't have to keep coming back. But the reality is, if you keep coming back, you keep feeling good. So, like, I think we overcomplicate this. And I love what you just said about, like, you got to make them laugh. You got to have fun with them. Why do you think most people struggle being fucking normal and human with their patients?
Well, I mean, there's a lot of burden in being a doctor, and I
Do you think
think
it's really
that's
being a doctor, or do you think they're just fucking retarded and can't be human?
I think that obviously everybody's really different.
How about this?
I
Do you
think some
think they're
people are naturally
stupid?
funnier than others.
Yeah,
I
that's
mean, they
true.
can't be stupid. They're a dir, although we do have a joke. We don't call you dir for nothing. Everybody has the capacity to do things that aren't that smart. But I just think that some people take themselves way too seriously. And I think that people feel like, and maybe it's an insecurity issue more than an intelligence or, as you like to say, a stupidity type thing. It's probably insecurity more than anything. People feel like they have to draw a line or keep it a certain way in order to have it be like they feel like they're in control of whatever the situation
Right.
is.
Right. I think you're spot on with that. I mean, the biggest fear that people have is being stupid and being afraid, and that drives them into insecurity. I mean, for
Yeah,
years I
lack of
remember.
confidence. I mean, but patients always pick up on that. You're confident or not. They even talked, some of the speakers talked about that this weekend, as a matter of fact. Tony Ebel talked about that. People know if you know your shit or you don't.
Yeah. Did he who'd you love? So obviously Tony was there. Did you get to meet Austin?
Oh, I already knew Austin.
I didn't know you met him before. I'm sorry.
We've
I
been
thought
to
you guys
dinner, we've hung out.
I never knew that.
I told him we talked about him. We laughed.
Yeah. Was his speech good?
I didn't go to Austin's speech. I think I was
Yeah,
in I
fuck
have to
that
take
guy. Yeah.
I have to take documentation for my Colorado license, so I think I was in documentation while he was talking.
So the most inspiring over Life Vision, who was the most inspiring?
Tony. Tony just
Really?
killed it. Yeah, James Chestnut was originally supposed to be the closing speaker, but there's some things that came up and he had to pull out at the last minute. And since Tony was already approved by the state to be a speaker, Tony did that topic. And man, he just knocked it out of the house, dude. He's just passionate and knowledgeable and researched, and it was really good, dude. I was inspired by him and moved by him. And I just, when you have that level of certainty, and he talked a lot about certainty, right? Certainty in what the chiropractic adjustment can do for a person and their life. And he brought it all down in neurology because he works with a lot of kids, right? And he's just throwing the data up there of the differences of, even frequency of care. What's the difference between seeing a kid twice a day for a week versus seeing them one time a day for a week? And he had the data and he threw it up. And actually, they're getting ready to do a peer-reviewed study on that with Heidi Havik in the very, very near future to prove that stuff. And frequency of the action makes the greatest change. And I've said this to my patients all the time. And I've also seen it. The people that have given it that realization to me the most are my husband's son, who had fireworks blow up in his face, and he was going to be blind for the rest of his life because of the burns had gone through the thickness of his eye. And after my husband had adjusted him basically every hour on the hour for 3 days straight, and not like I don't want to say not intentionally, because it was an intentional adjustment,
Yeah.
but like anytime his son was uncomfortable or squirmed or whatever, he did what he knew best to do, which was to adjust him, which was always a right.
Yeah.
And in 3 days, he woke up and he asked his dad, "Do you have a blue shirt on?" And he did. and he has 20/20 vision today. And so frequency of the action makes the greatest change. And so Tony has also observed that in his practice, and now he's going to prove it in empirical evidence and peer-reviewed stuff, which
So
we can
there,
all take peer-reviewed with a grain of salt too, because even Dell, when he was talking about peer-reviewed things, so much can be taken with a grain of salt because things can be peer-reviewed, but they pick and choose the data that they put in any of those things. And to the point also that people are being paid to review things, and
yeah.
conflicts of interest.
Well, that was the thing I saw when we were in my liposuction clinic and Cool Sculpting was coming out, and I saw that they had their peer reviewed stuff is basically like 11 treatments, and it was like a shot glass of fat that they removed, but as long as it didn't hurt anyone, they're like cool.
Well, same thing with what Dell was talking about. Like, there was some study, I don't even remember which one he was talking about, but their cohort was 167 kids that they observed over 5 days.
Yeah,
That was their peer-reviewed evidence. When you're looking at the millions of children that
yeah.
exist and the number of people, and then you look at this Ford study again, where they have like over 18,000 participants.
I mean, we're going to be biased, but I think, we know the truth. I mean, anyone who's been in a Cairo family, I mean, I remember when I would have the flu, I get on the table, 3 to 5 times in that weekend. Being at Dynamic Essentials and hearing the guys talk about their moms that are old and dying and putting them on the table 3 to 4 5 times over a week, which there's Dr. Gupta up in New Jersey who has people fly into her. She does great adjustment videos and she sees people over a 5-day period. Gonstead did that. That was
Right?
Gonstead. Like, I've been pushing that for years on my people too, is like, it doesn't have to be the tried and true, basic care plan that you think I think we're too afraid to just be like aggressive. And what Gupta's figured out, maybe this is the same thing Tony was talking about, that 15 adjustments over a period of time are the same as 15 adjustments over an extended period of time. Like, why not just get there faster?
See, I don't know about that because Tony's evidence from what he has in his own practice and the stats that he's been keeping basically shows that actually you're having more of an effect in that shorter amount of time. It's like revving up
Yeah.
the engine. Vroom, vroom,
It's
vroom, vroom,
yeah,
vroom,
that's what
input, input, input,
yeah.
input, input. Yeah, I think it's,
There's
I
gotta be
always
a
tell
rest period,
people,
obviously. There's gotta be a rest period. Yeah, but yeah.
and of course we're going to be biased because this is the world that we live in, but we have to recognize that that we have to sell essentially to people that are not biased to our side, if you will. And in the world that we live in, peer reviewed evidence is that evidence based practicing. And I always tell people it's a 50-50 on that. There's always going to be evidence for and evidence against whatever it is that you want to try to support. But I also tell people that because of technology today, science is now only proving the theories of chiropractic, the ideologies of
Yeah.
chiropractic. Our own bias is now being shown to be correct, right, and true. And I think that's super exciting. And that we even have this much more evidence and research to support the things that we do. Because honestly, anecdotes do make a difference, but we don't live in an anecdotal world anymore.
Well, I think spot on. I'm glad you had a good time there. I'm gonna be going to Mile High this week, as a lot of people know, and I wonder who's gonna want to fight me there. I have about 5 guesses, so I might get in a fist fight there. That'll be fun.
Make sure you get that on video.
I have a great post that's going around that's almost got 1,000 views on it about Sherman Life and other schools being Cairo doomed, because I want to do some clickbait and get people to like click
Oh, I
over.
saw that, but I didn't read it yet.
Yeah, well, it's just about the university as a I had a chance when I was at Florida, the Florida convention, to meet the founder of the school that's in Kentucky, and it's an attachment. It's not, it's not a full Cairo school. It's a program, right? He built the program into the Clarksville school, and so we're seeing the rise of, whether it's public or private, these, program based, not just the school based, and it supposedly makes it cheaper. I was digging at more at Sherman because I have the problem with that crew over there for a variety of reasons. Because one, most of the docs that come out of there are fucking broke ass idiots, and I love them because they're principle based, but they get caught up in just being this like principled. It's so like, as we talked about last week, it's starting to piss me off more and more. We're seeing neurosurgeons who are starting to take from our world, and we're seeing PTs that have done it for years.
Well, so that's interesting that you should say that because one of the presenters even just said when he talked about medical risk, he's like the one doctor that a chiropractor would want to refer to is a neurosurgeon
Yes,
because they're
it's the
gonna
last
do they're
case.
gonna do the work. No, no, no. they're gonna do whatever they do, and they're gonna send your patient back to you.
Yes, that's absolutely that's what I see with Dr. Yazdi in St. Louis. Shout out to Dr. Yazdi, who works with 6 to 7 of my chiros in St. Louis, and now is doing
Versus a
regen.
PT is more likely to try to take your patient and keep them.
Yeah, I think there's collaborate. I mean, the reality is like, look, we have to have collaboration. If you're stupid in this space, I'm doing my referrals, retention, in relationships workshop in 2 weeks. And a big portion of that is how to build the relationships with other providers. The fact is, I grew up with my dad's patients seeing 2 to 3. There's other chiropractors for specific issues with patients. If you have, one of your patients going to see a network chiropractor and they're seeing an AO chiropractor and you doing Thompson or Diversified, a
Or
patient
only
could see,
extremities.
yeah, like this vision of like it's only me and I'm gonna lose my patient and like fuck one, you don't own fucking anybody, and knowing that fact and being detached from that fact should help you fucking grow right away. You ain't dying with any of this shit. So, but yeah, I wrote about how these universities are coming in, and it really was just to push the schools that I do have a love and affinity for, but also to be on their tails a little bit that you can't get complacent and you got to do things differently and you can't rely on the same, because these same schools could fucking pull in some big mouths. Big mouths can always be bought, mine included. So I'm a fucking whore. You can buy me for anything. Listen, they just need a few voices and, a couple crate pizza parties with beer, and they're ahead of the game in like 5 years, so you can't get complacent and you can't get stupid and you can't get held behind the board. I think that's the thing that pisses me off about some of these like institutions too, is these boards that run the shit sometimes, and they're running it for the wrong purpose. I mean, we could go into that really deep, right? They that Sherman board, man, that's a man, that's a discussion for a whole day on what happens there.
Well, I'll say this about boards. I really, despite all the things that you and I may probably both know, I think that in the end, even the people that are on these boards, just like the medical doctor that we talked about last week, their goal is actually to try to do good for the institution, for the person. And in their minds, they
I
are.
think there's a majority, but the ones that are political manipulators and really good at that, unfortunately, do it for their own interests and own good down the road, and it affects, unfortunately, the wrong side of those universities.
Well, there's always going to be
Anyways,
that guy. There's
there's
always going to
always
be
gonna be
that
that
guy.
fucking guy. Yeah, that guy. Well, look, I also wrote about there's some great articles I have out there that people can check out. We're gonna be working on a program with you today, which I'm excited about, helping people with their care plans and making them like sizzle out there. I heard you got to work with Mark from Chiro Boosters. What do you think of that dude?
Like him. We haven't started yet. We're starting on October the 1st. But I mean, I'm already impressed with him. He's super smart.
Super smart.
Yeah, he's got all the things that you want to hear. And I'm not just because he's saying it and he thinks that's what you want to hear. He's saying it because this is the way that it is.
I had a couple of people I connected him with, or when we did our webinar, and he got on a call with them, and he said, "You got an A grade. There's anything I would do here." And people wrote me back. I really respect that and like that. I also wrote about this week the death of the selfie. We are in this weird paradigm. I don't know if you feel it too, Melba, but like social is changing because we're in this pendulum shift of the me and we society, and we're speeding up where the transition happens, right? And we're in this mixed emotions and this includes over to your patients, where they crave belonging but fear judgment. They want self-expression but second guess every move that they do.
It's funny what you say about judgment. I can't tell you how many times I was asked about judgment this weekend.
Would tell me more.
I just feel like a lot of people would say, well, you don't judge me, blah, 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 blah.
Like these, like the same people that go, I can't lie here, means they're shadowing that they're fucking liars every time they
Or
say.
they'll be like, are you secretly judging people or something like that? And I'm just like, well, yeah, who doesn't? Let's just be honest here.
Yeah,
We all
absolutely.
judge. But I have no reason to judge anybody. You know what I'm saying? But I just thought you say that. That's interesting because I feel like I had that question come up almost more than anything else. I heard about judgment, just people questioning judgment a lot over the weekend.
Well, again, the fear of not looking stupid. We're in this weird shift right now of people are like, who the fuck am I? And am I a me or a we're? And we're in that transition state. And
Well, I think
tell
that this assassination of Charlie Kirk has probably really expedited that because he was a man that was truly like who he was, and look what happened to him.
yeah. Absolutely. Well, I'll make a judgment myself. You know, I have my workshop coming up, and I got some people really excited about it. But I think it'd be obviously if I sold new patients on it, people would be excited because I'm gonna make a judgment here right now that it's really really hard for docs out there to focus on retention and referrals and relationships, and why that's hard for them. I think the number one thing is, and this is something that's really sticking to me that going to Mile High, and one thing I'll give Danny and his dad credit for is that they do focus on helping the doc become more impactful with their results. One thing that scares the shit out of me out there is the lack, in my opinion, the lack of investment into technique and further educating yourself. One thing I love and respect about my dad is he's forgotten more than he's ever learned. And I'll give all those guys and girls that out there that put energy and interest into putting investment and time into their technique, because you don't know everything. And I think to be like a stale creek, right? I think of that like a slow moving water river or whatever. If you want to turn the floods on, you got to keep putting back into yourself. You know, I bring that up because I think it's really hard for people to ask for referrals. And we're going to go over that in the workshop, because they don't know if they're actually getting the results that they think they should be getting. And one of the things I loved coming out of John's practice was he uses a cone beam x-ray, and it really looks
That's cool.
inside, and you can see the differences over 6 weeks, 12 weeks. And they tested, and that was the funny thing about the when Harry met Sally had, there's a part where he goes, we don't, you know, you can't fake it with me, because I can tell you the truth. I can tell you if you're getting impact and you're changing, and we're getting results. We do this test, this test, this test, this test. So I challenge and encourage all docs out there that you got to put more in, because there's your competition's doing that out there better. You know, the neurosurgeons that I was hanging out with the other day, you know, they're like, they make fun of every other doctor, not just chiros, but and this is funny because chiropractors and neurosurgeons are kind of the only ones that say this. We're not going to guess. You're not going to trust a neurosurgeon to do something with your brain, and they're going to fucking guess. But they're always talking about other doctors like, let's try this. Let's try this Xanax slash Adderall slash heart cholesterol medication. Let's just see how it goes for a couple weeks. You know, they're like marketers. Let's just try this and test this out, which I get, because you got to test to get there. But
And
anyways,
every person responds differently to the chemicals and the drugs. But I feel like Tony, not in the same context, had brought that up about certainty. They're trying to create research now that creates that certainty, so you don't have to see. Let's try and see what happens.
yeah,
Let's do this, and we know that
absolutely.
these are the outcomes.
Absolutely. Well, anything else for anybody out there this week?
Well, you did say something earlier about, people say things like, well, once you go to see a chiropractor,
You always got to
you
keep
always
going
have to
back.
keep going.
Absolutely.
But this is what I say to people. I'm like, yeah, most people do actually keep seeing the chiropractor because they recognize the benefit and how it helps their life and whatnot. But just question for you, how many drugs are you on right now? And when do you expect to get off of those?
Mm,
And then there's no conversation after that.
currently, I am on none, but I expect to be on 2 tonight, and I plan on not stopping.
But you get the point, right?
Yeah.
Because like all these people that are on drugs the rest of their life, they don't see the dichotomy of that. Like, oh, well, once you go, you keep going back. I'm like, okay, well, what about all the drugs you're on? When are you going to get off of those?
Yeah.
What's the plan to get off of those? There's never a plan.
Well, legally, you can't talk about that because you can't prescribe drugs.
Well, I'm not talking about prescribing
Just
drugs. I'm
fucking
just
with you.
stating facts that
Fucking-
generally there's not a plan to get off of them. And if there was, I mean, have I had conversations with people to say, yeah, talk to your medical doctor about that and see what the possibility is? Absolutely.
Or we should get prescription rights so that we can be able to take them off and put them on a plan. Just saying.
I mean, you know what? That's the good side of that, honestly. But
I
there's
know
going to
it's a
be
good.
some guy that's not
Well,
very good in
everyone
practice
fucks it
and
up for us.
has low
Everyone fucks it
self-esteem
up.
and can't do very well, and then he's just going to go to the dark side because he can't be successful the other way. So he's just jumping on the
We can't
train
worry
that looks
about those
successful.
motherfuckers because
The
everyone
train of
ruins
dogma.
everything. Everyone ruins everything for everyone if you let them ruin it. I'm really excited about Melba's program that we got coming out. We're going to go work on that, guys, today. And if you're looking to get your care plans sizzling and give me the pitch of why they should be doing this program that we have cooking up for you coming out.
You need something that people can take home.
Mm.
But there's one thing to sit there and scribble things on a piece of paper and tell people why it is, but people like to have something to take home and to hold on to, even if they never read it again. But also, if you're doing, at least in the state of Georgia, I don't know about the other states, but I mean, I guess it's similar. if you're going to do any type of a care plan and it's a prepay or whatnot, you need to have it written down and there needs to be a contract and it needs to be spelled out. If you have something that's written down that easily says, this is what's going on, here's the benefits, here's what's going to happen, here's the payment parameters, here's, informed consent, here's my missed appointment policy, and you have them sign that document, then you don't have people coming back and be like, well, you said this or that or blah, blah, blah. No, actually, it's written out right here verbatim. And, that's kind of like the aftermath for me, frankly, as far as like making sure that everything is the numbers the way that you say it should be. That's a afterthought for me as far as care planning was concerned. Really, it was like, how do you create a sellable care plan that somebody wants to buy that explains all the benefits of what they're going to get and the outcomes they're going to receive based on your care. And it can be highly personalized, not only to your patient, but to you as a practitioner. So you're getting your expression to that person and they're receiving it and accepting it and going in 100%. But then also with no questions about it.
Compliance, conviction, certainty, confidence. All
Exactly.
going to come out of
Exactly.
this. Maybe even you might come in your pants. We'll throw another C in there. So, listen. All right, we're going to get to work. We'll see you next week. Hey, if you're loving this, leave a review, subscribe everywhere that you can subscribe, and also hit me up if you want to be a guest, if you're not afraid. We're going to be breaking this out open into having some guests on every now and then, not every show, but I'm getting so much great feedback. And the truth is this, if you are yourself, authentically you, shit will only be better. So.
And you have to like saying the F word.
You got what? Oh, you got to say the F word to be on the show. Yeah, you do whatever. Well, do whatever you want. I actually, I do want to do here. Let me prep this. I put out there. I had to give my wife a warning. I want to bring in a high-end escort, like one of the highest paid escorts, because I want her to go over the differences between her escort site versus other people's escort sites, her listings on directories versus other listings. I think it's a fucking masterclass in marketing and knowing your worth. And I'm talking about like this dude that like charges like $30,000 a night to hang with her. We'll ramble in.
Absolutely.
So that will be one of our future guests. I'm trying to dial her in the next couple of weeks, but we will see you sometime next week. Twisted Toast coming at you. Thanks so much, Melba. We'll jam with you guys later.
Peace.